Yeah, thank you for giving me the opportunity to join the panel and this conference. And yeah, before I go any further, we've just witnessed the most tragic event in Greece, and I just want to say, like everyone in the room, that my heart and thinking is with everybody who suffered this tragic and are suffering this tragic event. When it comes to the conference, I think it's really a great opportunity for us to have, the conversations coming together around how can we progress on each aspect of the fight against cancer. And it's just great to see the level of interest. I mean, in the room we have patients and advocates, we have medical associations, scientific leaders, of course, industry representative, and policymakers. So it just gives me a lot of confidence, and this is what we need if we are to succeed. We've just heard from our Minister of Health, Mr. Plevris, from my fellow panelists. So I'll try to be short. I have a few minutes, and I really have 3 points that I would like to make. The first point really echoes what was shared earlier, which is the tremendous progress that we've been making over the last years. I mean, we should not forget that there are a few things that we can say today that we would not have been in position to say 10 years back. If we think of a recent report from the American Cancer Society, this report and study showed significant reduction in mortality due to lung cancer, which is one of the first, and most important cancer with breast cancer. We now see that patients that were diagnosed and treated between 2016 and 2018, 1 in 3 of these patients are still alive today. I wouldn't have been able to say this a few years back. You just quoted a number earlier, which is 65% reduction in cervical cancer incidence from 2012 to 2019 for a cohort of women that were both screened, and you touched on screening, as well as vaccinated, of course. So these are just a few numbers that just show the progress that we're making. And you touched on progresses that, under your leadership and joint leadership and the leadership of many in the room, are happening in Greece. I mean, we could name, and I want to really thank Minister Plevris for his political leadership with the government and with the entire, stakeholders in terms of the progress we're seeing over the last years. You mentioned the reinforcement of the whole legislation and around smoking, which has been a challenge. I grew up in Greece for a few years, that's why I have a little bit of Greek, and these times have changed. But there's also a lot that has happened in terms of innovating contracting to facilitate access to medicines for patients, the vaccination programs against HPV for girls and boys, the screening programs across multiple cancers, as well as a number of other measures. So it just shows the focus that you've been having. Now, that's the good news. At the same time, we know that the population is aging, and we also know, and that's another good news, that there's tremendous progress in science. And we've seen a lot of progress the last 10 years. We're going to see even more progress in the next 10 years, and you touched on some of those. So my second message is, let's not be complacent. Let's go after diligently implementing the EU Beating Cancer Plan and the plan that has been developed in accordance in Greece. Implementing this plan is so critical. I mean, it offers the full framework of how to progress, whether it's in early treatment, early diagnosis, screening, whether it's in prevention, whether it's in improved treatment rates and address the challenges around inequalities of care. And we know that we have significant inequalities in access to care still across Europe, and obviously Greece is no exception there. So one thing that is common there is measurement. What we need to do much better is measure what works, measure what doesn't work, measure our successes, measure our failures, so that we can not only experiment, but then scale in the best manner and have the highest impact. And there again, I think that Greece is very well positioned because you've done significant effort around digitization. There's more to do. You've got a great understanding on how you're spending the investments today. Let's turn now this into better understanding if what we're spending is producing the outcomes that we're looking for. That, I think, is something we need to work on a lot. And then my third message is really that we need to improve further cooperation, and we need to ensure that we have an environment, including a legislative environment, that is enabling us to innovate in Europe, innovate in Greece, but also ensure that that innovation reaches patients. We'll hear later on in a panel of the future that is going to happen on cancer care, and one of my colleagues, Dr. Vanessa Witter, will participate in that panel. And there's tremendous advances that are on the way, and some are being researched here in Greece. Now, if we think of these advances, they're coming at a time that European legislation is being reviewed, the entire Europharma regulation, at the time that we're reassessing how do we look at what we call the European Health Technology Assessment. So how do we look at this innovation? How do we evaluate it? And how do we ensure that it eventually is valued appropriately and reaches patients? And this is where I would like to call on political leadership that is going to be so critical in the next 12 months to really make the right decisions so that we assess well this innovation, so that we encourage innovation in Europe, so that in a way we have a Europe and a Greece that is competitive for patients. The more we have innovation in our countries, the more that innovation will eventually reach patients as fast as possible. So that is really what I wanted to share. We're making progress. There's a lot to do ahead of us, but we will do well if we implement the cancer plan, and let's have the right environment to do this. Thank you.